Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Etidronate. Its brand name is Didronel. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Etidronate works on bone metabolism to slow bone turnover in pegetic lesions as well as normal bone. In terms of indications for use, Etidronate is indicated to be used in the treatments of Paget's disease. We see this medication used in hypercalcemia of a malignancy. And finally, it can also be used to treat heterotopic ossification. Now, before somebody was to use Etidronate, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. Patients with a hypersensitivity to Etidronate or any other component of the product would not be able to use this medication. If a patient had clinically overt osteomalacia, which would be softening of the bone, they would also not be able to use Etidronate. And finally, patients would not be able to use Etidronate if they had esophageal abnormalities that delay esophageal emptying. Now, in terms of precautions, patients should be made aware that an adequate intake of calcium and vitamin D is required while using this medication. Hyperphosphatemia may occur with high-dose therapy of Etidronate. Local irritation of the upper gastrointestinal tract may exacerbate some active gastrointestinal disorders. Some of these may include Barrett's esophagus, duodenitis, dysphagia, gastritis, or ulcers. Esophageal adverse effects, including bleeding or esophageal stricture or perforation, have been reported. Patients would be at an increased risk of experiencing these if they were to lay down after taking their dose or fail to take the medication with a full glass of water. Mental disabilities that may prevent proper understanding of administration of Etidronate may put patients at an increased risk of experiencing severe esophageal adverse effects. Osteonecrosis of the jaw has been reported, and patients may be at an increased risk of experiencing this if they were getting chemotherapy or if they were using corticosteroids. Invasive dental procedures such as a tooth extraction, dental implants, or bone surgery may put patients at an increased risk of experiencing osteonecrosis of the jaw. For patients who use this medication who have renal impairment, more close monitoring would be recommended and a dose reduction may be necessary for a reduced glomerular filtration rate. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Etidronate, they can expect to receive their dose orally. If somebody is going to use this medication to treat Paget's disease, they may use 5 to 10 milligrams per kilogram per day orally for up to 6 months. Alternatively, they could use 11 to 20 milligrams per kilogram per day for up to 3 months. For oral maintenance therapy of hypercalcemia of a malignancy, patients would typically use 20 milligrams per kilogram per day for 30 to 90 days. Use above 90 days is not recommended. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Etidronate, so I'll go over some of those here now. Some patients have experienced gastritis while using this medication. Other patients may experience leg cramps, and a headache may occur in people using Etidronate as well. Now, some more rare but serious side effects would be esophageal erosion, esophageal perforation, joint pain, bone pain, or osteonecrosis of the jaw. That's all we're going to talk about today with Etidronate or Didronel. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.